guys, so as an orthodontic assistant, I do 90% of the work where the doctor does 10% of the work. It's really different from assisting in general dentistry. In the past, when I was assisting in general dentistry, I only did about 10% of the work. So I'm going to go into detail what I do from day to day as an orthodontic assistant. All right, let's go. So before getting started, I do want to put a disclaimer out there. Every office is different, so what I do will be different from what you do or what you see in a practice. So when you first come in the office and you're interested in braces, that will just be like a regular exam. At that exam, as an assistant, I will get your photos. I will get 2 x-rays, which is a ceph and a pano, and then I'll get a 3D scan of your teeth. At your next appointment, it will be called a bonding appointment. That will be the appointment where you get your braces. At that appointment, as an assistant, I will go ahead and prep your teeth before we get the braces on. The first step, I will profile your teeth. Basically, it's the same thing that's done at your hygiene appointment with your general dentist. Once I get all of the teeth profiled, I will go ahead and prep the teeth some more by using some conditioner, which gets your teeth really clean. Once I get that done, I'll seal your teeth so the glue will just adhere better with the braces. Once that is done, I will call the doctor over. Once the doctor comes over, I will go ahead and pick up each brace or bracket with the bracket holder, and I'll get a small amount of glue onto the back of the brace. This is done one by one. Once I get one brace loaded, I'll go ahead and place it on a tray, or I'll place it to the doctor directly. And at that point, we'll just go back and forth. I'll go ahead and load, and then I'll hand it over to the doctor or place it on a tray. So we'll just go back and forth like a little dance. Once all of the braces are placed onto the patient's mouth, the doctor will go ahead and leave, and then I'll go behind the doctor and I will shine each bracket with the light that basically hardens the glue. Once all of the braces are dry and the glue is hardened, I will place wires and colors on the patient's teeth. If you need bands, which are like tooth rings on your molars, instead of getting the traditional tubes and hooks, which are still braces on your molars, as an assistant, I will place those bands. However, if those bands are needed, you will need separators before you get those bands placed. Assistant, I do place separators and I do place bands. If you need an appliance, as an assistant, I will place your appliance. We have a lot of different appliances. As an assistant, I've placed an expander, which is basically an appliance used to expand your upper palate. Placed a Herps appliance, which is basically an appliance that's on the upper and the lower, and it has tubes that connects the upper and the lower going back like this. That Herps appliance basically is used to bring the upper jaw back. I've placed one of those. I've also placed a nance appliance, which is used to hold the molars in place and keep them from shifting. You can have a nance appliance on the upper or the lower, just depending on what you need. Next appointment, we call those adjustments. At those adjustment appointments, as an assistant, I will change your wires and I'll change your colors. The doctor will come over either before to let me know what's needed. Most of the time, that's already written in the chart, so he'll most likely just come over after I've completed the work, just to make sure everything is fine with the patient and that the work is done. If you're getting Invisalign as an assistant, I will do everything for Invisalign. I'll go ahead and prep your teeth in the beginning like I did with the traditional braces, and then I'll go ahead and get each tray loaded with the glue that's needed for your attachments. Attachments are basically those little grooves that you see on the trays. Those grooves are basically made by placing a small amount of glue inside the trays. Once I get that glue placed, I place the trays on the teeth, and then I'll go ahead and use the same light that was used to harden the glue with the traditional braces and harden the glue with each attachment. Once that is done, I'll go ahead and remove the trays and then get your actual trays in the mouth. The doctor will come over once that's completed to make sure everything is intact. He'll let the patient know how many trays he would like the patient to take on and how often he would like the patient to change trays. At your debond appointments, that would be your appointment where you get your braces removed. As an assistant, I will do everything at this appointment. The doctor will come in at the beginning to check to make sure that the braces are ready to be removed and that the patient's happy with the smile. Once the doctor leaves, I will go ahead and remove the brackets using a little plier, which basically just takes the brackets off just like butter, really smooth. Once all of the braces are removed, I will go ahead and use the slow hand piece to remove the glue. However, depending on where you work, you may not be able to remove the glue. At my old practice, the doctor did remove the glue only because they did use a fast hand speed. Where at my practice, we use slow hand pieces, so I do remove the glue. Once the glue is removed, I will get impressions, which are basically that gooey stuff that's used to make impressions of the teeth. Once I get those impressions made, I will make retainers for my patient. So the next step that's done in order to make the retainers is pouring up models. As an assistant, I will pour up models using the impressions that I took of my patient. Once those models are poured up, I will make my patient's retainers. Next appointment will just be retainer checks. At that appointment, the doctor will come in and adjust the retainers if they need adjustment, only if it's a Holly retainer, which are those metal retainers. He will come in using a plier to adjust the retainer to the fit of the patient's mouth. So that's basically it. Thank you so much for watching this video. Go ahead and comment any questions you may have, like, subscribe, and I'll see you guys next time.